Hello viewer, once again welcome to my continuation lecture number 4. In this lecture we will talk about the alkylating agent. In our previous lecture we have already discussed about the different classification of anti-neoplastics antibiotic. So let's talk about the mechanism of action of alkylating agents. The mode of actions or mechanism of action of alkylating agent is it can interfere with the process of the cell division of the malignant and normal cells. Let's suppose you are going to target the cancerous cells or the abnormal cells. So it doesn't mean the drug will reach to its target sites, mean the drug will be specifically used or the drug will particularly target that area which is infected by the cancers. Secondly, after binding with DNA, there are different compensatory mechanisms. So this mechanism and this mechanism, we can easily say that how the drug is bind with the DNA and cause, because in cancer there is abnormal outgrowth occur, abnormal cell divisions. As we have talked about in mitosis, and that sometime in normal cell divisions, what will be happen? So it causing the breaks and preventing the DNA replications or inhibit the enzymatic reaction. So this is very simple, that sometime there are also involvement of certain enzymes which are also responsible for the replications for the, so in order to prevent the DNA replications and to cause inhibition the enzymatic reaction, so it will causing to break off. And you know that cancer cells, they are very susceptible to this clause. Susceptible, this is, it means this is very sensitive. So especially in it is not necessary that just we are using a single drug, but in this case like I have already explained in my previous lecture. So look at this slide. You can see here that there are certain drugs like anti-metabolites, anti-neoplastic, antibiotic, alkylating agents, platinums containing compounds like plant alkaloids, microtubules, and steroid hormone, and their other antagonists. They are also even monoclonal antibodies. They are also used for the in some particular cases, while they in miscellaneous. So I will explain each and every topic in detail one by one. So this is clear that alkylating agents, this is one of the sensitive group or susceptible to, you can say, the cancer cells. They are more sensitive and more susceptible to alkylating agents. Okay, now look at the these are the very classical examples of alkylating agents. So one is the Busulphans and cormustines, chlorambucils, cyclophosphamide and decarbazines, and apospamides and lomostines, mecloethamines and melpelons, and streptozocines and temozolomides. So just these are the you can say 11 drugs, 11 agents which we will explain. So now let's come toward the clinical uses or pharmacokinetic, that what the drug do with the bodies. I mean that in this case you can say the clinical uses. The clinical uses, so it is the part of pharmacodynamic, not pharmacokinetic, because in pharmacokinetic as usually we are studying about the metabolism, the absorption, eliminations of the drug. Clinically these agents they are used in a combination therapy, especially for hematological malignancy, especially cyclophosphamide. It is used in the treatment of like whenever there is cancer in head, neck, esophagus, breast, lungs, bronchi, ovaries, cervix, prostate, and testes. As well as it is also used for Hawking disease, lymphomas, and many and more conditions like acute and chronic leukemias when there is abnormal production of white blood cells, and malignant brain tumors. So they are also indicated from the malignant brain tumor. So once again, I would like to repeat these things that come toward the ADR, adverse drug reaction, which is always unpredictable, and these reactions occur unpredictable means sometime due to overdosings. When you couldn't maintain the concentration of the drug in the body, definitely this drug will cause a severe type of reaction. Is you can say abnormal kinds of reaction or unwanted reactions, that is in the form of ADR, which is always occur due to overdosing. There may be chances of bone marrow depression. So definitely when bone marrow depression occurs, so the hematological process, the blood formation process overall, so it will be disturbed. So immunosuppression may be occur, and JT irritations may be occur, while in case of use of alkylating agents, there you can see the abnormal changes in the gonadal function, like gynecomastia abnormal development, especially with the use of these agents. There may be chances of testicular dysfunction. It will decrease your sexual desire, libido, and amenorrhea type of condition, but it is always, that's why it is very important to maintain the concentration of the drug in your blood plasma. So another ADR which is reported by the literature, so after use of alkylating agents, so skin hyperpigmentation may be occur. There may be chances of alopecia and stomatitis. So inflammations, you can say there is inflammation of the oral mucosa, especially of there are many and more condition. Okay, so now come to drug interaction. So the same thing, same topic, you can say drug interaction. This is one of the major issue, so which is reported with the use of multiple drugs. So in drug interaction, it can antagonize the effect of anti-gout drug. For example, we are using anti-gout drug like colchicines, or many and more drugs which are used for the treatment of gouty arthritis. So if it is used in a combination with the those drugs which are used against gouty arthritis, so it will must produce antagonism, so they will cancel the effect of one another. So for example, in live viral vaccine, if live viral vaccine, they are used with the cyclophosphamide, which is the anti-cancer agent, so what will be happen? So it will ultimately decrease the antibody response of the vaccine, and as usually these vaccines are antigenic preparation, so how you can activate your immune system? So definitely the live viral vaccine, but is used when a combination with cyclophosphamide, so what will be happen? So ultimately it will decrease the antibody response of the vaccine. So that's why this drug can be used with precautions. So the next group is platinum containing compound. So inshallah in my next lecture we will talk about the platinum containing compound, which also come under the category of the antineoplastic agents. And thank you so much for watching this lecture. So if you have any question in this lecture, so you can ask me, and you can directly email me, and we have already my WhatsApp number. So thank you so much for watching this lecture.